Sorry, I'm gonna get that started. Okay, so how's everybody's week been? Good. I'm not too tired yet. Oh, we're tired. That goes for everybody who's not pregnant too, huh? Well, the first thing I wanted to tell you is I got on Facebook and I asked all my friends who had babies naturally to give me, what would you say to a first-time mom who's planning on having a natural birth? And actually, I was kind of surprised that a lot of my friends had a natural birth that I didn't even know had. So here's some of the things they said. Um, one girl said, yes, it really is that painful, but at least you don't have to worry about the side effects of drugs. Someone else said, the more you understand about the process, the less scary it is. And then this lady who just had a baby 2 weeks ago, I was with her, she said, you know your body better than anyone. Always trust that what you're experiencing is vital in the labor process. God will not give you more than you can handle, and the pain you feel is your body working with you and your baby. And then Samantha said, it helps me knowing that there is an end in sight. For me, by the time it gets really painful, I know I just have a few hours left. And then my cousin who's had 8 too shall pass naturally said, this too shall pass. And somebody else said, plan for it like you would plan for a marathon. Prepare your body and you'll be able to think of labor as intense, not unbearable. And then somebody else says, much easier to handle the after pains of childbirth after going through it naturally. I was up walking around, and she says, how much better the recovery was after her natural birth. So those are just some words of encouragement for you. And one thing I was thinking of, something I tell moms when they're going through it, is that there is that end in sight. When we plan a trip, like we're planning on going on vacation, we plan a trip, I always like to add up the time and figure out what time we're going to get there. So say we're going to Pensacola, and we're going to Pensacola, and it takes us about 8 hours to get there. So if we leave here at 8, it means we'll get there about 4 o'clock. And so that's the time I have in my mind, 4 o'clock. And so if we're driving down the road and we stop and get some lunch and we spend 30 minutes in a restaurant, my mind says to me, okay, well that's 30 minutes you don't have to spend in the car because you're 30 minutes closer to 4 o'clock. That's not how it works. No. You still have to work that much to get there. But that's just like a trick that my mind plays on me. But birth is not like that. Birth, there is a definite point when your baby will be born. Now you don't know that time, but it's already set. That time will happen. And so if you think in your mind as you're going through it that there's a time that the baby will be born, all I have to do is manage until we get to that point. All I have to do is cope to get to that point, and then the baby will be born. So it's not like riding in a car where you actually have to do something. You just have to manage until that happens. So there is an end in sight. If we go back to what we were talking about last week, did y'all do any of that reading through the brain things? Get some perspective on some of those things. Well, the fact is that most of these things, hopefully, you will not have to even worry about. There's a few things that you'll have to go through as far as the IV and some of those hospital procedures, but most of the problems, scenarios that we talked about are not even something that you're going to have to handle. In fact, your labor most likely will look something like this. Now, this is Penny Simpkins' Roadmap of Labor. And if you want to take a few minutes to look at that, you guys can pass it around. You see there's a natural progression that usually happens, and it usually happens somewhere around that sequence of events. Now there's a couple sidetracks there. There's the bumpy road, which is back labor, which can happen sometimes, and then there's the epidural superhighway. But most of the time you're just going to follow that path, and it's going to get there. Understand that? Does it need some explanation? But you can see, the different things that are along the way of things that you would be doing during that part of labor. It's just an idea of probably what you're going to experience. So, for the next few minutes, and sometime in the early evening or late evening, let's say 8 or 9 o'clock, things start getting a little bit more serious, and you're getting tired, maybe. You're still, you're still handling each contraction, but now you start really thinking about how much longer do I have to do this. I don't know how much longer I can do this. My strength is only so much. And you might start to shake a little bit. You might start to, contractions are getting really close now, maybe every 2 minutes apart. What's some things that might be going through your head at that point?
Epidural.
Yes. What might you do to cope with that? What's some things that you can do?
Take lists of things why it feels so bad.
Good. Yeah, have that ready for somebody to read to you. What's some things that you might be able to do for her, Michelle?
Oh, reassure her, be there, tell her, and coax her on, and keep it up, just lift her spirits, get her any, like, do something to take her mind off of it.
Excellent. Sometimes just a position change. Hey, let's go use the bathroom again. Let's try this hot rag on the back of your back. Let's try this rice sock. That's something that you can bring to the hospital. You can run down to the microwave, heat it up, and bring it back and stick it right on your back. And it's lovely. Okay, so you're moving through. See, that was 8 o'clock. So maybe 9:30 comes around, and you start in your contractions. You might even notice it first, but your people around you start to notice you're starting to grunt in your contractions, and you're starting to feel this urge, this pressure push down, and so you're starting to think, oh, I gotta push. What stage of labor is that? Where are you?
The last stage.
Yeah, the exciting part. And so, the nurse will be like, okay, well, let's give you a quick check, and sure enough, you are 10 centimeters. You are ready to go. And so she coaches you a little bit on how to push, where to push. You're pushing to your bottom. You're going to give those good hard pushes, and the baby's going to go down, and the baby's going to come back. The baby's going to go down, the baby's going to come back. And it's molding the head and stretching you out. And finally, the baby's going to come down, and it's going to stay. And so then you're going to give those small nudges, and the doctor's going to come in and get you all set up. And it's like a flurry of activity. They all come in, and the doctor stands there and just kind of gets ready and massages you a little bit, and then your baby's head comes out. Oh, the relief at that point. And then the baby's shoulders come out, and then you have your precious little baby on your chest. And it's not even midnight yet. What might you be feeling then? Happy in what?
Sore.
Happy that it's over? Happy that you did it? Happy that you faced something that was harder than anything you've ever faced before, and you did it. What might be your questions or concerns at that point?
They care.
Yeah.
I don't know if I want to know that one.
Well, they'll tell you. want is that left side, and we want the baby anterior. So that's the side you're looking for. If it's not that, that's fine. You can work towards that, but at least if you know that the baby is posterior, you can make sure that you're leaning forward, make sure that you're doing some different positions where your legs are up, like one leg at a time. Sorry, I'm wearing a skirt today. One leg at a time per contraction. Otherwise, if they say, yes, your baby is anterior and it's on the left side, then you're going to be, woohoo, let's get this show on the road. So they're going to tell you that. They're going to check your blood pressure. They're going to be doing that frequently just to make sure that you're handling labor correctly. That's the way they determine how you're handling labor is your blood pressure. And they sometimes, they'll leave it on for a while. And so after a while, sometimes they forget to take it off. So if it bothers you, you can ask your nurse to remove it. They don't have to have it on you continuously. But just, periodically they'll do that. They'll be checking your temperature to make sure you're not getting an infection. And they'll be checking with vaginal exams periodically to see how far you're dilated. Some places they like to check every 2 hours. Sometimes they let you go a little bit further than that. So that's one of those choices. It's up to you as far as how often you want to know how dilated you are. And sometimes, they can check you and just not tell you if you prefer. So then for baby, they're going to be checking your baby's heart rate. That's what there's going to be 2 monitors on you. One's going to be checking your baby's heart rate, and the other one's going to be checking your contractions. Hopefully you have wireless monitors, which makes things a little bit more easy. And the baby's heart rate, like I said, I think I mentioned to you, it will normally go up during a contraction. And so seeing the baby's heart rate go up during a contraction is nothing to be worried about. We're just looking for it to go right back down to its regular spot. So you'll have it, usually it's in the 140s, 150s range, and then you'll have a contraction, it'll go up maybe 160s, and then it'll come right back down. So that's what they're looking for, and they're monitoring that from the nurse's station, even if they're not in your room watching. And then, they're going to be looking at how your contractions are going. So if you want to turn to the page where it says newborn exam, you can see what they're going to do. As soon as your baby's born, they're going to want to give your baby an APGAR score. And I put it on there so you can see exactly what the APGAR score is. You get, for each of the 5 items, you get either a 0, a 1, or a 2, or your baby does rather. So they're going to look at your baby 1 minute after your baby's born, even if it's, just in your arms, they don't have to take the baby away. And they'll just look at your baby and see, monitor the heart rate, the respirations, muscle tone, color, and response to stimuli. And they'll give your baby one of those scores. Now normally you know, they wouldn't have to do surgery or anything like that. They would just have to have a special bite. So that's something that you can choose to do, or you can choose to decline. It's up to you. And then there's also a hearing screening that they usually do sometime within the first week of your, usually before you even leave the hospital. And it's not like, I don't know, have you ever taken a hearing screening in school? What did you have to do? You had to like raise your hand? It's not that kind of hearing screening. I always wondered, I was like, how are they going to get the baby to respond to sound? But no, they put these, a little cup over the baby's ear, and then they send a tone, and then they measure as it bounces off the eardrum, many getting rid of the bilirubin. You might have built up the bilirubin, but it's you know most babies have vitamin K and are just the vitamin K shot and are just fine. So that's something to weigh the benefits of the risk. If the baby had an injury at birth, like say they had that shoulder dystocia that we talked about, or had a bruising, sometimes the baby can have a bruise on their head when they come out just because of the way they were positioned. That might be something to consider because you have that injury. But you know there is that risk of bilirubin jaundice thing.
So if when they prick them,
Mhm.
are they still going to keep bleeding? I mean, is it?
No,
they
that
don't
the
have
little
enough?
the little heel prick isn't gonna do anything to them. But if they had an injury where they had bruising, is what you're looking for. Sometimes babies come out really black and blue because they come out. Usually when they come out too fast, they can come out completely bruised. And they're fine. They just have that the extra bleeding to worry about. The alternatives, yes.
Whenever you get done, I just want to know what jaundice is.
Oh, we'll definitely talk about that. But I can go ahead and tell you now. Jaundice is when, after your baby's born, again, it's like we're trying to get rid of that bilirubin, and your baby's liver and all its organs are just starting to work. And so it's not as efficient at getting rid of those extra bilirubin cells as we are. And so sometimes if those bilirubin builds up in the baby's system, your baby will turn yellow. And that's called jaundice. And when the baby looks yellow, especially when their eyes are yellow and their nose, you press them, and when you pull away, they're yellow, then that means that they have an excess of bilirubin. It happens quite frequently. The best treatments for it are sunlight, because that vitamin D gets rid of bilirubin from sunlight. Nursing frequently, the more you can put milk through your baby, the more that they can get rid of that bilirubin out their poop and pee. That's what makes the poop yellow. And in those beginning stages, and then just sometimes they do bilirubin lights, which is just the extra vitamin D that you just get from the sunlight, but they put it on the baby extra to get rid of that extra bilirubin.
Okay.
Any other questions? You understand? Okay. So the vitamin K, there is an alternative where you can order your own vitamin K drops. That you would give your baby under the tongue, and it's over more of an extended period of time. That way your baby can process the vitamin K, but you would still have the same problem with the vitamin K having to be processed versus the bilirubin being processed. But then you wouldn't have to give your baby a shot, is the only difference between the drops and the shot. And then if you did nothing, your baby's vitamin K levels will reach their normal adult, well, not necessarily adult, but their highest level at day 8, and they will be fine by that point. So, any questions there? Okay. And then the hepatitis B, I'll just go ahead and say some hospitals do give a hepatitis B vaccine right after birth. I mean, before you even leave the birthing room, they try to give you hepatitis B. What that does is that retroactively prevents the baby from getting hepatitis B from the mother if the baby contacted the mother's blood within the birth process. And so that's just something to consider. You have the same risk factors of all vaccines, except for you have them in a newborn who has not, their systems have just started working. If you think about their liver and their kidneys and all those organs that have just started working, that might be something to consider when you're considering whether to give the baby the hepatitis B shot. So you're gonna want to know how safe it is, right? A lot of people, especially once you have babies, you might start checking those crash test safety ratings. You want to know how safe it is. You're gonna want to know if it's reliable. Does it even work? Does this car run? You know, I was, you know, I don't know if you get the ads, the classifieds. I've seen them before where it says car needs new transmission, new engine, and new interior. Runs great. You're like, what? or I'm going to make sure that we do one vaccination at a time instead of them all grouped together. Or I'm going to wait so many months in between each vaccination. There's compromises that you can make. I just want you to start asking the questions so that you know what you're going to do.
Can a pregnant woman get tetanus shot?
I'm not sure. That's something you can research at the CDC. I did put the CDC's website on there. I do believe, so you can look that up if you want. I can look it up for you before our next class, but I put that on there. Maybe I didn't put the CDC on there. But I think, yeah, it's at the bottom of here. It says the CDC.
Now, I've always been a believer in the vaccines. Maybe not some of the newer ones they had, but for your old stuff, because they were rampant at one time. You know,
Right,
without them,
Um,
we would have been bad shape.
Yeah, and I'm not a vaccine or no vaccine kind of person. I'm a let's take it one step at a time. Let's take it one vaccine at a time. One thing to consider too is especially if you're having little boys, is things like measles. That when a boy gets measles at around 13 years of age, it can cause, measles or mumps. I think it's mumps. It can cause big problems with their procreation. I mean, it can sterilize a little boy. Well, some of these vaccines, especially not this age, but some of the vaccines for those only last 10 years. So if you get your baby vaccinated when they're a baby and then 10 years later it wears off and you're not thinking about it because you're busy with your life and you're doing little league and then your child comes in contact with that disease at that age, it's more dangerous. It's more dangerous than if they would have gotten in contact with it when they were young. So if you plan on taking the vaccine route, make sure you stay up to date with it. Don't let it lapse because that's when you can come into problems.
My confusion on the whole with the vaccines is, I know with livestock, there's no use in giving under 4 to 6 months any vaccines because it really doesn't work for them. Their body just isn't together enough to make it work.
That's interesting. I didn't know that.
Oh,
So
yeah?
yeah, those are some other. I've had so
So-
many questions about vaccines. I haven't even had all my questions answered. But those are things, especially when you're shopping for a pediatrician. Ask if that's something that you want to negotiate with. Ask for a pediatrician or look for a pediatrician who's going to work with you. Not one that's going to be one way or the other, but this is going to work with you and answer your questions about each vaccine. I know one thing that you want to look for, especially is not to have any live viruses. Make sure that they are dead viruses. The polio vaccine, when they give it to you live, it can actually enter your body and then spread to somebody else. And the way that it spreads, it's deadly to the person you're giving it to. It's not like passing a vaccine; it's passing a disease. So those are things to consider when looking and shopping for vaccines. Okay. There's a lot of questions that can be asked about vaccines, and that's why I gave you lots of resources so you can look through and make those decisions on your own.
Well, what sucks is you pretty much need these to do anything that you want to do.
Right.
Like, college needed my vaccine records.
Right. And you know what? For this is a bit personal information. My kids are not vaccinated yet. They're planning on homeschooling, but I will most likely get them. As I look through that, I say, well, we'll probably get a tetanus shot. If they do not come in contact with chickenpox or measles, mumps, and rubella before age 10, I'll probably go ahead and get them vaccinated probably around age 10 so that they're protected through puberty. When they get to college, I'll probably encourage them to get the vaccines when they're getting